Hi, everyone, and welcome back. I wanted to make a quick lecture here as kind of an addition to the other longer lecture that we have been, that you guys have watched, sorry, on issues surrounding gender identity, on sexual orientation, on sexuality, and that kind of thing. And basically, I just wanted to make there's a lot of things that I could talk about, and a lot of issues that we could continue to explore and discuss, but I don't want to take forever here. And so, in this, I want to focus specifically on the ideas surrounding transgenderism and legal situations that we find ourselves in, in particular, the treatment options that are available from the medical community for transgender individuals. Now, some of you are probably aware that in addition to all of this, there have been some recent legislations about how professors should and should not conduct themselves in the classroom. And I want to make sure that I respect the law and follow it. And so I'm going to run through a couple of things that are happening right now just to make you aware of. I'm going to give you some sources because it's important to note that according to current legislation, professors cannot advocate for a particular thing. However, professors, of course, have freedom of speech to note that maybe others have advocated for something, or that a particular theory does exist, or a particular framework does exist. It is just that professors should not maybe be advocating for one over the other in certain situations and scenarios. So I just kind of want to run through a few things and give you a little of that information. One thing that I'd like to note is that first is that Florida has become the 8th state to restrict transgender care for minors. Florida is now set to block gender affirming care for trans youth. They have passed a new rule from I think it's the Florida Board of Medical Advisors or something like that, right? To quote an NBC article here, however, I would like to note that they say, quote, the rule contradicted most medical evidence as well as guidance from nearly all relevant medical associations in the United States, including the American Medical Association, the American Academy of Pediatrics, and the American Psychological Association. Those are both the largest, the oldest, and actually the most respected medical organizations in the United States. And the current finding of the state of Florida goes against what they say is really best for transgender care for young people. One of the reasons that this has come about is that many individuals are saying that the transgender care that is being offered is somehow mutilating or harming young people. Okay. Governor DeSantis actually specifically said that doctors are, quote, literally chopping off private parts of young kids. Okay. A little bit of an internet search will find this article on PolitiFact that says, quote, that is not true under any existing medical guidelines, said Dr. Jack Turbin, assistant professor of child and adolescent psychology at the University of California, San Francisco. Quote, no medical or surgical interventions are considered for pre-pubertal, easy for me to say, children, right? In fact, actually, very recently, the county attorney general for the state attorney for Hillsborough County, right, was actually removed from his position by the governor because he said that he would not support, and he pledged not to criminalize anyone that was providing gender affirming care. And so this law was kind of making its way through the legislators, and Andrew Warren, the state attorney for Hillsborough County, said that he promised not to sort of criminalize anyone that was actually providing these services that the American Association of Pediatrics, the American Medical Association, and others support. He wouldn't do that, and so the governor actually removed him. You know. And this is something that is, I think, closer to all of us than we might realize. This was an article that was published on NPR very not that long ago, right? And this is actually a friend of mine. I know this family. Um, this is Jen and her daughter Liz. Liz actually went to pre-K with my youngest daughter, and then went to kindergarten, first grade, and second grade with her as well. So I've known Liz, and Liz has known my daughter since they were, I think, 2.5, maybe 3 years old, right? So these are our community members that we're talking about here. This is not an abstract thing, right? And it's probably more prevalent than you might think, right? According to the Pew Research Center, about 5% of young adults in the United States say that their gender is different from their sex assigned at birth, meaning that they are either transgender or gender fluid. Okay. I am going to be doing a lot of reading from this lecture because, as I said, I want to show you what other scholars have argued, not necessarily what I am arguing. Now, in all this talk about gender affirming care, what is it, right? We're saying we're going to get rid of this gender affirming care or things like that. So what is it? So I'm going to use the citations here from the the American Association of Medical Colleges, right, which does like sort of the accreditation and other things for universities that train all doctors in the entire country, right? So this is sort of the big board above all of them. So I'm actually taking this from their website. Gender affirming care is defined by the World Health Organization, encompasses a range of social, psychological, behavioral, and medical interventions designed to support and affirm an individual's gender identity. You guys have read about gender identity. We don't need to repeat everything. When it conflicts with the gender that they were assigned at birth, in other words, gender dysphoria. The interventions fall along a continuum as well, from counseling to changes in social expression to medication such as hormone therapy. For children in particular, the timing of these interventions is based on several factors, including cognitive and physical development, as well as parent consent, which is going to be something you'll see them repeat over and over. Now, probably the most common thing that you've heard if you've been watching the news about gender affirming care is puberty blockers. Puberty blockers are something that helps sort of prevent some of the onset of primary sex characteristics, right? So transgender youth who have not started or completed puberty can receive puberty blockers. They are not given to people post-puberty, right? For a number of reasons. This will suppress the release of sex hormones such as testosterone and estrogen. The Mayo Clinic explains that for those identified as male at birth, the blockers decrease the growth of facial hair and body hair. They prevent the voice from deepening, and they limit the growth of genitalia. For those identified as female at birth who are on puberty blockers, the treatment limits or stops breast development, and it stops menstruation. One thing that I want to point out here is that puberty blockers, if they're stopped, right, they stop working. This is not something that has the long-term sort of bioaccumulation characteristics that a lot of people think of, right? And so you can stop them. This is a kind of stop measure in a lot of ways. One purpose of puberty blockers is to allow a young person to fully determine their gender identity and how far they wish to transition before the onset of permanent sex characteristics, right? So it kind of, it's pausing our video game a little bit, if I can compare life to video games. If you'll forgive such a crude analogy or sloppy analogy, it's kind of a pause button, right? It allows us to do that, basically, is the way it's seen by many doctors. Another form of gender affirming care is hormone therapy. Now, this is something for older youths, right? Usually in mid-adolescence, and adults. So those individuals who are past puberty, right? These are puberties in the past. You've already gone through all of that. Puberty blockers aren't going to do anything because you already had puberty. What's it going to block? A thing that already happened. It's, you know, it's diffusing the bomb after it's blown up. So in that case, then you can look at things like hormone therapy, right? As I said, older youth, usually in adolescents and adults, can receive hormone therapy to increase their levels of estrogen or testosterone so that then they develop sex characteristics more closely aligned with their gender identity. So the puberty blockers block the development of the sex characteristics that an individual does not identify with. Later on in life, you can, though you don't have to, take hormone therapy in order to develop those sex characteristics that more align with your gender identity. These include more hair growth and increased muscle mass for those transitioning to a more masculine presentation, and breast development and testicular atrophy for those that are transitioning into a more feminine presentation, right? Again, not all trans people decide to go through hormone therapy for lots and lots and lots of reasons that are surrounding their personal preferences, their personal identity, the advice of their medical professional, conversations that they have with their family and loved ones, other medical reasons, things like that. Lots and lots of trans people don't actually do hormone therapy, right? Some, as we kind of mentioned in the other lecture, because they're actually gender fluid, and while they're saying I'm transitioning away from being maybe a male, I don't necessarily, that doesn't necessarily mean that I'm a quote unquote woman as society conceives of that dichotomy, right, that we talked about before of A or B, one or the other, either or. It's like, well, I'm not either, so I'm just kind of moving out of that framework, right? So there's lots of reasons. Among the criteria that are typical for providing hormone-related therapies for youths are: one, a finding that the youth has experienced several symptoms of gender dysphoria listed in the DSM, the Diagnostic and Statistical Manual, which is like the go-to. Like if you know, this is the handbook of disease, right? All sort of disease isn't the right word, right? But diseases, illnesses, problems, you know, things like that, they're all listed in this, right? And it's a very established criteria, and it's revised. It's been revised many, many times by the medical community to establish what is this, what is this, what is this, you know, all of those kinds of things from you know, gender dysphoria to depression to you name it, right? Whatever it is, right? And so a young person has to have experienced several symptoms of gender dysphoria, right, for at least 6 consecutive months, right? Number one. Next is a letter of support from the youth's licensed therapist, right? So they have to be seeing a therapist that is talking to them. I mentioned this in the other lecture before, that in the past, not now, in the past, there were a few cases, not many, where individuals would have, they would transition, they would maybe take hormone replacement or hormone therapies, they might even have sex reassignment surgery, and they regretted it. Because of that, the medical community said that person's issue was something else, and we need to make sure that they do not make a drastic permanent change. And so we're going to make some criteria to make sure that that does not happen. Okay, so you have to be in therapy, and you have to get a letter of support for this from a licensed therapist, and right, written concurrence from a mental health professional before you can do any of this, right? So you need both these things. You need two, right? You need mental health professionals, you need a therapist. So you're talking about basically psychology and psychiatry both need to come together and agree, yeah, no, this is in the best interest of this individual. You need parental consent if you are under 18. This idea that it is being forced on anyone, that young people are being talked into it by professors, teachers, activists, YouTubers, TikTok influencers, whoever you want to blame right now. And kids are just deciding to do this. Again, they're going to have parental consent if they're under the age of 18. And they're also, I have a misspelling here, I apologize, ongoing psychotherapy, right? So it's not just like, here are some drugs, have a good life. That's not how this works. You have to have continuing ongoing psychotherapy, talk therapy, all kinds of different stuff in order for them to prescribe these medicines for you. Okay. And also, there are standards of care that have been established. I cited some before, right? I said that like all of this is like the benefits of this are acknowledged by all these different organizations. This is just a few others. Like there's a bunch, but there's also standards of care of like what you should do, right? What you should require prior, during, after, right? What kind of therapies they should be in, what kind of interventions you should try first, what kind of conversations need to be had, who should be involved in this process, right? The American Association of Pediatrics, the American Psychiatric Association, the Endocrine Society, all of these have these basic standards of care of saying you must meet this criteria, period. right? You must do these things both as a person, and you must do these things as a doctor, as a healthcare provider. So this is not a vending machine that you go to, right? They have these things really well set that doctors have to follow. You know? So this is also something I want to say that is very important, right? Numerous studies have found that transgender youth, especially those experiencing gender dysphoria, are significantly more likely than other youth to suffer emotional distress and depression, to experience bullying and other forms of violence, and to harm themselves or attempt suicide. This study found that 61% of transgender youth had considered suicide. They had suicidal ideation. That is so high. That is absolutely off the charts compared to other young people that we see. 61%, almost two-thirds of young people who are transgender, who have gender dysphoria, have thought about suicide. So this is not something that is unimportant. This is critical, critical services that young people need. Okay. And access to gender-affirming hormones during adolescence and mental health outcomes among transgender adults. This research looked at 27,000 adults and young people, I want to say, and found that basically, you can look up the study if you'd like. Basically, everything got better. That if they had this gender affirming care that we're talking about, suicide rates went down, suicidal ideation went down, depression went down, feelings of self-confidence, self-acceptance, you name it, everything got better overwhelmingly when we're talking about mental health outcomes when young people got this care. So what I want to say here is, like, this is what this care actually is. This is why it's important, and this is why it's important, why it's needed, and this is what it can actually offer to young people. So to cut through all of the internet nonsense, right? These are the things that we're actually doing. Doctors are not quote, literally cutting the genitalia off young people. They're not doing that. What they're offering is puberty blockers, psychotherapy, counseling, right? Later on, they might be offering hormone replacement therapy, things like that. That's what's actually being offered. And what we find is that without those things, there are a host of negative outcomes. With those things, there's a host of positive outcomes. Okay, so that's kind of the broader point that I wanted to make there. And I'm talking about youth right now because, and again, this is just another study that's kind of saying the same thing. A new study finds that access to gender-affirming hormones during adolescence is associated with better mental health outcomes among trans adults, right? Obviously, this is something that's impacting adults as well. I'm talking about youth specifically because that is what the current legislation and political conversation is focused on. But I think that if you look at many peer-reviewed, scientifically based, data-driven studies, it often paints a very clear picture, which is broadly then confirmed by every single major medical association, not only in the United States, but in the international community, including the World Health Organization. I would encourage you to look at those sources if you would like more information on that, and to trust those sources more so than some of the others that are unfortunately a little more common. Okay, so again, I want to keep this brief and not take up a ton of your time, but just to kind of inform you a little bit about some of the facts and things like that. So thank you all. Always a pleasure. See you next time.